So welcome back. We are still running the arterial ECMO 4 liters per minute in a case with severe left heart failure. Despite lowering systemic vascular resistance and afterload, as well as the blood volume, we still have an unacceptable dilatation of the left ventricle, and we are looking for other measures to improve unloading. And if you look at left atrial pressure, it is 22 and right atrial pressure is 3, and this means that an echocardiogram will show the extreme bulging of the left atrial septum from left to right, and it's therefore tempting to create an artificial atrial septal defect and see how well that unloads the left side of the heart. So let's introduce a shunt. First we'll increase the area from 0 up to 0.5 square centimeters. You see that while we are doing this, the left ventricle will shrink and also left atrial pressures will go down substantially. Stroke volume from the left ventricle also decreases, and we now have much less pulsatility. We've also lost some arterial pressure since the total cardiac output is now smaller. If we continue to increase the size of the atrial septal defect from 0.5 square centimeters up to 1 square centimeter, we'll see that left ventricular stroke volumes are barely able to open the aortic valve, and we also see loading of the right side of the heart with an increase in pulmonary arterial pressures, right ventricular pressures, and also right ventricular stroke volumes. In this situation, unloading is acceptable, but since we lost a lot of cardiac output, mean arterial pressure is now smaller than acceptable, and we need to increase systemic vascular resistance to keep up blood pressure. Aiming for a mean arterial pressure of 65. And when we are doing that, actually stroke volumes from the left ventricle disappears completely, and we now have a non-ejecting left ventricle, meaning that there is stagnation of blood flow inside the ventricle and a risk of thrombus formation. That is a non-acceptable situation. Therefore, you have to be careful with atrial septostomies if the left ventricle is really bad. It provides efficient unloading, but there is a risk of a non-ejecting ventricle with thrombus formation. Thank you.